Hi, Kristen. First, I want to thank you for taking the time to come in and meet with me today. Over the past couple of weeks, you have shared some concerns related to your level of worrying or concern as it pertains to your son's safety and just how you've been experiencing some difficulty in managing these feelings. With this in mind, today I wanted us to sit down and complete a brief self-assessment tool. Now, this self-assessment tool is commonly known as the GAD-7 or the Generalized Anxiety Disorder Assessment. It's really important for you to understand that the GAD-7 is not designed to diagnose you with anxiety. It cannot do so. The GAD-7 is more of a general use assessment. It can be used across multiple different locations, multiple different fields, multiple different scenarios with multiple different clients. It is designed to be more general and just kind of help us pinpoint the severity of the anxiety symptoms that someone might be experiencing at a certain point in time. Now, I say a certain point in time because when we're completing the GAD-7, we will only be looking about how we have felt over the past 2 weeks. We will not consider how we felt when we were 5, or how we felt our entire lives, or how we felt when our grandma died a month ago. We will only consider how we felt over the past 2 weeks. There are 7 questions, as we said, on the Generalized Anxiety Disorder Assessment. Those 7 questions are related to how you've been feeling. So, for example, one of these questions will be whether you've been feeling nervous, anxious, or on edge over the past 2 weeks. With each one of these 7 questions, there are going to be 4 answer choices. There will be not at all, several days, more than half the days, and nearly every day. So, for example, if you feel like you have been experiencing anxiousness or this feeling of being on edge for 5 days out of 14, you would probably be likely to answer several days. That is not more than half the days and is not nearly every day. However, if you find that for 11 days out of those 14 days, you have felt like you were on edge, you will answer nearly every day, because that's only 3 days out of 14 days where you didn't have to sit there with this feeling of being on edge. If you have a question that comes up and you're unsure how to answer, we can talk about it. However, I cannot guide you or lead you into whatever answer it is. We can only talk about the wording around the question that is confusing you. That is our way of ensuring that this is completely 100% from your perspective and that we're getting the most accurate results. Again, the GAD-7 is not to diagnose you, but it is to help us understand the severity at which you are experiencing these anxiety symptoms and to help us as we move forward with treatment planning. In order to receive a full diagnosis, we would need to take into account other considerations such as personal life circumstances. Again, going back to the example of your grandma dying, that's something that we would want to take into account before we give you a diagnosis of anxiety. We'll have to take into account things like your personal cultural background and just what's been going on outside of those environmental factors that played into your upbringing or played into your situation, and what is personally true to you and who you are as a person. So we will look into our conversations and have more conversations before you would ever receive a formal diagnosis. Once you have completed the GAD-7, we will sit down and we'll talk about your assessment results. We'll look into treatment planning options and we'll figure out where to go from here. Take your time to complete this assessment and choose the response that accurately reflects your experiences over the past 2 weeks. Let me know if you have any questions. Thank you.